The following guidance is based upon CDC interim infection prevention and control recommendations for patients with or under investigation for COVID-19. Perform hand hygiene. Apply 1 pump of hand sanitizer to the cupped palm of one hand. Rub hands palm to palm. Rub the right palm over the back of the left hand with interlaced fingers and vice versa. Rub both palms together with fingers interlaced. With the left thumb clasped in the right palm, rub rotationally and switch. Cup the hands and place the backs of fingers to opposing palms and rub side to side with fingers interlocked, rotationally rubbing the clasped fingers of the right hand in a circular pattern on the palm of the left hand and vice versa. Continue to rub both hands together until the sanitizer is dry. Double check the gown for defects and untie any knots in the ties. Isolation gowns cannot be donned over the head. Don the gown by inserting your arms into the sleeves with the opening to the back. Tie the neck and waist ties in bows that are easy to release, as this will facilitate easy removal by eliminating the need to struggle with untying knots. Don N95 respirator that you were most recently fit tested to at your last fit testing. Hold the respirator in the palm of your hand with straps facing the floor. Place N95 respirator on your face, covering your nose and mouth. Pull the bottom strap over the top of your head and place at the nape of your neck below the ear. Pull the upper strap over and place it behind your head towards the crown of your head. Mold the nose piece using pads of fingers over the cheeks and bridge of your nose to obtain a tight seal. Be careful not to pinch the nose. Perform a seal check by taking a few deep breaths and feeling around the mask for escaping air to ensure there is a good seal against the skin. Don the face shield so that the foam headpiece rests on your forehead. If you are wearing goggles, ensure that they are not interfering with the fit of the N95 respirator. Don patient care gloves to a size that is comfortable and conducive to providing patient care. Prior to donning gloves, the gown cuff may need to be pulled towards the knuckles to prevent the gown sleeves from riding up. Ensure there is no skin exposed between the gown and glove cuffs. The white cuff of the gown should be completely covered by the glove. As you provide care to patients with COVID-19, take precautions to keep from contaminating your PPE, such as stepping to the side of a patient that is coughing. Under no circumstance should you readjust your PPE while in the patient care area. If gloves become grossly contaminated, wipe them with an EPA-approved disinfectant wipe, those with the gray top, and perform hand hygiene on the gloves. Remember to perform hand hygiene as you normally would when caring for patients by performing hand hygiene over the patient care gloves, before touching the patient, before clean or aseptic procedures, after body fluid exposure, after touching your patient, after touching the patient's surroundings. If you feel you have contaminated your gloves at any time, perform hand hygiene on them with alcohol-based hand rub. Try to limit touching the surfaces, as this may lead to contaminating your gloves and spreading it to other areas. Removing PPE, also referred to as doffing PPE, begins in the patient room in an area as far away from the patient as possible. Try to position yourself close to the exit with a waste container and linen hamper within reach. All of your PPE, with the exception of your N95 respirator, is to be doffed by the door inside the patient care area. Prior to doffing your PPE, check for signs of gross contamination and remove it if possible with an EPA-approved disinfectant wipe, those with the gray top. The doffing process must be performed slowly and diligently to prevent contamination to healthcare workers from contaminated PPE. Perform hand hygiene on the patient care gloves for a minimum of 20 seconds or until the hand sanitizer is dry. Remove the gown. Isolation gowns cannot be removed over the head. This is a self-contamination risk. Carefully untie the gown at the waist and neck. Remove the gown, folding the outside of the gown tightly inward into a ball to contain the contaminated side. Once your gown is contained, separate the gown from the gloves and place gently into the linen hamper. Remove the gloves utilizing the glove-in-glove technique. Take your dominant hand and pinch the palm of the non-dominant hand and remove the glove. Ball the removed glove into the hand of the remaining glove. Slide pointer finger at the free hand under the cuff of the remaining glove and remove. Place gently into the waist. Perform hand hygiene. The last item of PPE to come off in the patient care area is the face shield. To remove it, bend slightly forward and grasp the elastic headband on both sides of your head and pull it forward and away from your face. Place the face shield gently into the waist, face down. As you exit, the only item of PPE remaining is your N95 respirator. Exit the patient care room by opening the door, stepping out, and ensuring the door immediately and completely closes behind you. Perform hand hygiene. Lean near the waste container and remove N95 one strap at a time. First, remove the bottom strap of the N95 with both hands and let dangle. Then, remove the top strap of the N95 with both hands and place gently into the trash. Perform hand hygiene. If there are two providers in the room, have your teammate untie the bows in the back of your gown following their hand hygiene. If at any point you feel that you've contaminated yourself, notify your supervisor. This may be due to your respiratory protection being compromised, or perhaps you inadvertently touched your face or eyes with potentially contaminated hands. Linen and waste do not require special handling for COVID-19. Do not push down waste or linen to make more room in the bags, as this can aerosolize potentially infectious material. Do not allow trash containers to become more than 3/4 filled. Do not allow linen hampers to become more than 3/4 filled. When removing trash from the patient care area, take it immediately from the room to the linen or trash chute.